Hello and welcome. You're watching NDTV 24/7. I'm Osama Shah. Shefali Jariwala, the beloved icon of the early 2000s music video era and a vibrant TV personality, she died unexpectedly at the age of 42. While cardiac arrest is being suspected as one of the causes, authorities are still awaiting the post-mortem results and assessing other possible factors, including the potential role of epilepsy. Her untimely departure, it has deeply impacted the fans, her colleagues, and the entire entertainment world. Her death has led to speculation as well over the probable causes behind her death. Her reported ongoing treatments and medical history is also being discussed as the police are yet to reveal the cause of the death. Shefali Jariwala's untimely death, it has raised a lot of questions. Was it because of the anti-aging therapy that she was taking? Was it because of her epilepsy that she had suffered from the age of 15? We'll try and find answers to some of those questions. I'm currently joined by Dr. Sameer Gupta, Senior Interventional Cardiologist and Director, Metro Group of Hospitals. Dr. Sameer Gupta, coming to you first, is there any sort of relation between the kind of treatment that she was taking? She was also suffering from epilepsy. Was that also one of the reasons? What do you make of it? What is your assessment?
Yeah, thank you, Sama. First thing we have to understand is that when anybody dies, right? Anybody dies, whether it's because of epilepsy, because of a heart attack, of malignancy, kidney problem, whatever the cause of death is, in the end, it's a cardiac arrest that happens, right? Your heart stops functioning, and that is when you are pronounced dead, right? So now a cardiac arrest can happen because of many, many reasons. Many reasons, heart attack being one of them. Whether it's epilepsy, there are some conditions, and the other panelist over here can discuss about that. It's called SUDEP. He can talk about that. It can happen because of electrolyte abnormalities. It can happen because of heart attack. It can happen because of a reaction to a medicine. So there are many different reasons why somebody can have a heart attack. And regarding your question about these extra therapies that she was taking, it's difficult to talk about it if you don't have all the information, right? If that's all hypothetical and conjecture. That is it because of X, Y, and Z? I think what is going to be very important in putting some light on the cause of death is going to be the autopsy. That is when we will really find out what was the exact reason for the cardiac arrest. Was it a heart issue? Was it a brain issue? Or was it something else that was going on that was undiagnosed?
Absolutely. And as you mentioned, we are still awaiting the post-mortem results. Until and unless that report is out, we cannot certainly say what exactly caused her death. And this is a matter of speculation, and we have been maintaining this here on NDTV. But what we have also understood at this point of time is that it could have been a case of sudden cardiac arrest. What I want to understand from you, Dr. Sameer, is do you feel that when you speak about anti-aging therapy, etc., we have tried and understand this. We have tried to learn about it, but nowhere did we find that it is related to people dying with cardiac arrest. Do you think it is related in some manner, especially when you look at the surgical part of it?
Usually these anti-aging therapies should not have a systemic interaction, especially the ones that you mentioned are all topicals. So that topical means it's just put on the skin, and usually the systemic absorption into the blood is very less. It usually should not have that. There can be an occasional random case, maybe. There can always be a 1 in a million case, and that's not for me to speculate on. And regarding the surgeries, all these facelift, brow lift, eyelid surgeries that you mentioned over here, these surgeries are usually done in a proper doctor's office, and I'm sure that she would have had this done at proper places, regulated places, at accredited places, and not just a random, a random place. Usually, when you have these surgeries, you get anesthesia. It could be local anesthesia, which is just lidocaine over here, or it could be general anesthesia, depending upon the type of surgery. And during the perioperative period, there can be some bad things that can happen, but that incidence is also very low. I'm not sure if these anti-aging therapies are completely related. to this. It could be just a random association, but I'm not sure if we can say it's causation that this anti-aging therapy caused a cardiac arrest.
Dr. Samir, are there any known interactions between anti-epileptic medication and supplements or drugs that are often used in anti-aging regimes? I'm talking about growth hormones, stimulants as well. Do you feel there is any known interaction between the two?
So I'm not sure about the interaction of growth hormone with anti-epilepsy drugs, but growth hormone supplementation when you become an adult can increase the risk of atherosclerosis, which is blockages in the arteries of your heart, and that can subsequently cause heart problems. In fact, many times you see a lot of the bodybuilders and wrestlers, they are taking supplemental steroids, and that can also have a negative impact on your health. Even though you may build some muscle temporarily, it can increase and accelerate the process of atherosclerosis. It can increase the risk of hypertension, of mood disorders, and that can again have a detrimental effect on the heart and cause cardiac arrest and other problems.
Dr. Samir, there is a big worry about how young people, fit people, they are dying of cardiac arrest, and we have seen so many examples in the last couple of years. Uh, Many celebrities who take care of their bodies, who take care of their health, they have an entire team of nutritionists with them who take care of the food that they eat, and yet you see cases where these people are dying of cardiac arrest, sudden cardiac arrest. Do you feel there is a pattern? Do you think it is about lifestyle? What are the primary reasons that you can think is causing this?
Yeah. So I think it's important to understand what are the different causes. So we've already discussed that cardiac arrest can be because of many reasons,
Yeah.
one of which is a heart attack. Now, if we have to talk about a heart attack, let's try and understand what are the causes of a heart attack. What are the risk factors that lead to a heart attack? And there are usually some common risk factors, which is high blood pressure, which is called hypertension, high sugar, which is called diabetes. You can cigarette smoking is a very big risk factor, a family history of heart problems. If your father, grandfather, mother, a first degree relative has had heart disease at a young age, then you, by nature of the genetics, are at a higher risk of having heart problems. High amount of stress can cause heart problems. There are well-known conditions that show this, and even high cholesterol can cause heart problems. Lack of sleep can cause heart problems. So there are many different reasons that can sometimes come together, or even in isolation, lead to an acceleration of the process of blockage formation that can lead to heart problems. Now, we during the time, there are also some inflammatory conditions like rheumatoid arthritis, SLE, which are autoimmune conditions that can also increase the risk of heart problems. Now, these people, for the most part, are fit. Like you said, they've got nutritionists, they've got health coaches. But we also have to understand that were these people taking supplemental medicines to look that good, to like you mentioned, growth hormone and testosterone. Were these people taking some of those medicines? And with heart, it's important to remember that supposing you have a heart attack at the age of 42, it is not something that if you've been fit for the last 2 years, you don't get a green chit and you are off. Heart disease is a slow and these things are slow and gradual processes for the most part. So slowly and steadily, blockages happen, the heart gets stressed, something else happens, the heart gets stressed a little bit more. So that's why it's a lifelong health regime that usually you have to live, and not something that now I've taken care of myself, so I'm off the hook.
Yeah, yeah. That's a great point that you have made, Dr. Samir Gupta. Dr. Samir, what would you want to say to the young people who are watching this?
I would try to echo the sentiments of Dr. Gupta as well. That it's that lifestyle. There is no magic potion, right? I mean, you can have as many pills as you want. You can do whatever you can. There is no magic potion. You have to live healthy. You have to be healthy. You have to exercise. You have to just take care of your overall self. And it's very important that that people get themselves tested for high blood pressure, high cholesterol, diabetes, some of these risk factors. Oftentimes, I get people who are fairly young. I get people in their 20s and 30s with high blood pressure. And I tell them that, you need to be on medicine because your numbers are really high. And they take it very casually. They're like, no, no, doc, I'm just in my 20s. How can I start taking medicine? But if you have a problem, then it is important you address that problem. So when you're in your 40s, when you're in your 50s, when you're in your late 30s, the compounding effect of years of ignoring some of these illnesses doesn't lead to problems. So it's important to get yourself tested, just live healthy, be healthy, eat right, and exercise. Now, those are some of the simple things that you can do.
Dr. Samir Gupta, thank you very much for speaking with NDTV and making sense of all those things that we spoke about, we talked about. And I genuinely hope that everyone, especially the young people who are watching the show right now, who are listening to you guys, they implement all of that you have mentioned.